Hello, hello, and happy Tuesday. Just wanted to jump on and have a conversation with the ladies today in the house about pelvic floor health. So, this is just kind of a continuation of the conversation that we had last week, which was highlights to the power of menopause event, which was probably such one of my favorite, events that I have attended and was a part of. Oh, and Melissa's jumping in here too. So today we were talking about pelvic floor, and I want to just kind of summarize a little bit about the conversation that was in front of the room to the women and the message, the powerful message for women on pelvic floor. So I'm going to be totally honest with you. I really never knew that pelvic floor specialists existed. And I'm 52 years old, and I just kind of found out about it in the last year. Maybe because I didn't want to know about it. Maybe I didn't want to go down the rabbit hole. Maybe I didn't think I needed it. I just didn't pay attention. And I don't know if there's any women that are watching this or will watch it. I'm curious. Do you know that a pelvic floor specialist even exists? Melissa, how about you? Like, did you know about pelvic
No,
floor?
I would say the most I knew were Kegels. That is the extent of it.
Right. So here, this we got to go here, ladies. Like to me, this is a game changer for women, and we need to be speaking to every woman, friend, sister, neighbor when you go for those conversations with a woman. We need to start talking about this. So the information I'm going to share to you today, I am giving you permission to have this conversation with every woman that you care for because it's so important. So here's some things that I have learned. So I actually booked myself an appointment this year. I was curious, like who as a woman is not curious about what is happening down below, right? Like, is it good? Is it falling? Is it, all of that stuff. And
I think a
so,
lot of people ignore
mhm,
it, actually. You just think, you don't want to think that there could be something wrong, right? Or you just, that's the way it is. Because nobody
so
knows about
true.
it. Nobody talks about that. So, yeah, until somebody brings it up, then you get curious, like you did. Yeah.
Right? It's taboo, right? Oh, we can't talk about that. Giggle, 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 right? The little girl, like, oh. And this is like the conversation that Melissa and I want to keep on having with women is breaking these taboos, breaking these like uncomfortable conversations. It's like, think about this, women. It's the most important bodily function that a woman has, giving birth. It is our power center as a woman. And yet we don't talk about it other than like if we get pregnant and we give birth and then that's it. Oh my gosh, we can't talk about it. But this is the great thing about being a wise woman in this stage of being a wise woman is we get to talk about this and then we get to change the stigma to the younger generation that is coming up, is that we can have a conversation openly to our daughters and our sisters. So I'm going to tell you a little bit about, I'm going to go there. I'm going to tell you a little bit about my appointment. So I live in Canada. I found out about this pelvic floor specialist through the circle of my health professionals and friends, and I got a few referrals to her. So I'm like, I'm in. I also interviewed her on my podcast. So my podcast is still available, Gorgeous Gray Podcast, and you can go to that episode with Sheila Zelmer, and we go there in a much detail. So if you want more detail than what I'm giving you today, go to that podcast. It's incredible. You can find it on Spotify as well as Apple. So I went and she was great. She communicated exactly what was going to happen in the appointment. It was like your checkup appointment. It was about an hour. And what I loved about her is that it wasn't rushed. She gave me the full hour and it was a conversation about, I need to understand your history, the size of your babies. Did you have any issues after birth? Did you have any sexual trauma? Like, hello, like this was important to her because she's also went back to school and became like a sex coach, so we can go there and have that conversation. So she wanted to know my whole background about my relationship with my pelvic floor. How important is that? Melissa, how about you? Like the conversation about like You've been reading some books around that conversation with the womb. Any comments on that connection to a powerful woman and having a relationship with her pelvic floor on all levels?
Yeah, I think it's been asleep because, as you say, it's taboo. It's a topic we don't talk about. Um, how could I say? It's almost as though women have forgotten just how powerful they are, and that really is our power center,
Mhm.
because we bring life into this world. And I don't know, just I guess the society we live in, right? The patriarchal society. Oh, women are emotional, and oh, they have their period every month, and it's a nuisance. And it's that, as opposed to that's like what literally brings life into this world. And we're emotional beings for a reason. Yet it's been deemed a negative thing. So it's so important to tune back into your power there. Absolutely.
Yeah. So, couple things. So, I went to this appointment. She told me what to do. Obviously, you take your pants off, you have a little cover up, and she tells, me what she's going to do. So, she actually goes in with a lot of lube. She's like, lube is important at this age, right? You don't want to hurt the tissue, tear the tissue. So, some healthy lube. We talked about lube. I can tell you that in a sec. And she said, I'm going in and I'm going to teach you. First off, I'm going to ask you how you do a Kegel. So I did one, and she's like, do a couple more. And then she said, okay, so I'm going to let you know that you're doing it the opposite of what you should be doing. And I was like, oh, I've been doing wrong Kegels for all of this, time. So she taught me, and it was a practice. So, Melissa's a personal trainer. She is always using technique to make sure that you're lifting properly, that you're not injuring yourself. Well, the pelvic floor specialist does the same thing. So, my challenge to everyone is that you need to go for a pelvic floor examination to find out the state of your, I'm going to say pussy, vagina, whatever that word is for you. Might sound, ooh, that sounds, but really your powerhouse, right? Find out what's going on. So then what she does, and I thought this was very fascinating, and she goes, so I give women a score. And I'm like, ooh, a score. So it's a score out of 5. And she goes, the reason why that we have that is it's based on that, like the health of your vagina, like how strong it is. So I'm going to be honest with you. I didn't get a great score. I got a 2 out of 5. And she wants me to get to a 4. So she said, but why this is important for you is it's thinking about, urination, like how that you can have the strength to hold your bladder and all that area when you have to go to the bathroom. Um, and if it's getting weaker and not stronger, you're only 52 years old. It's like, Melissa talks about like the strength training, right? Like, these, the bat wings, right? Like if you're not training parts of your body for strength, and as Melissa says, lifting heavy shit, we're going to wither away. Well, it's kind of the same as our, pelvic floor. So she taught me how to do it properly. And it's like 2 to 3 times a day, only 10 Kegels a day. Now, I was a candidate for Kegels. She also explained that there are women that come into her practice and they should not be doing Kegels just because they're holding on. When you're stressed and you hold on, you can also be very stressed in your pelvic floor. So Kegels would actually probably do damage down there. So that's really important. So should you do them or should you not is something that you need to ask the question. And then she wanted to do a rebook 6 to 8 weeks out to check, am I getting stronger? No different than if you're hiring Melissa Hyde to do personal training. Melissa, you're going to be like, let's meet again. Let's see your technique. Let's see if you are developing muscle. Let's see if you are eating enough protein. Well, we never think about hiring a pelvic floor specialist and checking in with them, but we need to do that. So I mean, I'm not an expert by any means. I just went to my first session. I got to go and rebook with her so that I can go and see how I'm doing. But it's awareness. And, I see my mother who's in her 70s. She's never been to a pelvic floor specialist. And, You hear women like, oh my gosh, as they get older, they're getting up, what, every hour or two at night to go to the bathroom. That's not normal. When she did her presentation, she did say if you're about 55 years of age or older, a healthy, normal bladder, you should only get up once during the night to go to the bathroom. Anything more than that, there are some issues going on down there. So just maybe reevaluate where you're at and how many times you get up in the middle of the night, to go to the bathroom. And then we talked a lot about like healthy lubrication, especially when it comes to sex. And I'll finish off with a couple more thoughts. Hyaluronic acid is an ingredient that we use typically on our face and our skin. It's in a lot of beauty products, especially as we age. We're being marketed to this hyaluronic acid, but you can actually get products for your pelvic floor that has that ingredients in it to help with hydration, right? And plumping up the tissue down there. Because oftentimes as we get older, as our estrogen, leaves our body because we're not menstruating anymore. And if we're not on bioidentical hormones and you are getting some issues down there, there are things that you can do. So you can get like a localized estradiol from your pharmacy, connecting to either your naturopathic doctor or your functional medicine practitioner, or maybe your medical doctor that is up and knowledgeable on how to support a woman down there. Because a lot of medical doctors don't have this training. One of the things that really stood out for me is the medical doctor, Dr. Wiz, that had a conversation with all of the women in the room. She said, I just want to let you know, every one of you, when you leave here today, will have more information on menopause and how to support your menopausal body than your average medical doctor. Now, think about that. Melissa, any comments on that?
Oop, trying to unmute. Yeah, I thought that was so powerful for women to hear that. It's kind of sad, but at least now they have knowledge and they know questions to ask and the types of health professionals to go and look, because it is a natural part of aging, of what we go through. But women didn't used to live that long. So doctors don't know what to do with us. They haven't gone to school. So you got to find the doctor that has actually gone to school and studied this, because there's so much that can be done to give people relief. There's needless suffering, as I say, going on. And now they know. Now they know. So good.
Exactly. So, as I wrap up today, my message is all about pelvic floor. Please go find an expert in your community and go get a full pelvic floor. Find out if you've got any prolapse going on. There's like 4 different common prolapse. If you've had babies and you have had big babies like me, I am more prone to risk of prolapse. And prolapse is not fun when you start to get older, because that means everything is dropping down. There's a lot of muscle down there. And if we're not using it, as Melissa said, in our body and even down on our pelvic floor, like what's the saying? If you don't move it, you lose it. Well, you need to make sure that you're moving it properly down there. So get an evaluation and find out. It's kind of like when I tell women, like, stay on top of your blood work, right? Make sure you know where your vitamin D level is. Check in on your hormones on a regular basis. Like the joke, holy cow, this is a big task that we're asking women to do. And the task is self-care and self-responsibility. And you cannot let your medical doctor tell you what to do, because you might see them once a year and they don't even know what to do with you. So that's all I wanted to say today. I'd love to hear your thoughts and comments below. I'd love to hear if you got a really good pelvic floor specialist. Share them in the group chat, because this is a community of sisterhood and we want to definitely share with you our favorite people. I can definitely drop my information down below, and we just want to get the message out. Take care of your pelvic floor. It is your powerhouse. Any last minute words on the advice?
Yeah, just as I always say, is one thing at a time. Nicole just rhymed off 10 things we need to be doing. And that's what I said to her. Do you do anything other than go to appointments lately? But one thing at a time. Don't get stressed. Don't get overwhelmed. One thing. So if this is, you're noticing things going on down there, you're like, oh, maybe I'll do this. Great. Make that your one thing that you're going to do. because it's so much easier to prevent stuff than try to get it back. Right. So one thing at a time. Don't be stressed that you didn't know this. It's okay. You're doing the best you could. And now you know a little more. So it's all good.
Awesome. Thanks for tuning in, ladies, and we'll see you next Tuesday at 11:30, just with Melissa, because just so you know, I will be on an airplane
Woohoo.
flying to Cancun, and I know Melissa is traveling to Puerto Vallarta on Friday, so when she tunes in next week, she will be in the hot, beautiful Mexico sun, tuning in, hopefully not teasing us too much about the beaches of Mexico.
I'll keep my jacket on. They won't see.
Awesome. Thanks,
Have a good
everyone.
day, everyone.